If you don't have, you have any questions, we could move on to the summary. Of course, if there's any questions, we could have that now. Right. So if there's no further questions, I'm just going to summarize the meeting. I hope you had a good meeting today, and I hope that this was useful and educational. You saw from the first talk that the bifurcation treatment still remains problematic, and we still need to find a solution for doing a bifurcation procedure. And you've had an overview of the side guard capillary stent, which in my mind is one of the new technology that closely comes to what we call an ideal technology for bifurcation therapy. So this is just basically my last slide, just to give you summaries of what we think the advantages of side guard and what are the disadvantages. And I think the main point that was stressed today is the simplicity of the device, the fact that it's very simple, easy, quick, safe to use. It's a self-expanding, but we are familiar with the delivery system because it's the same system we use in terms of balloon expanding stents. The important thing is that you never lose the main branch wire, so that in terms of safety, that's important. Another important point is that you're always securing the side branch with good scaffolding and easy access. Of course, you do need some skill in terms of accurate positioning, but the learning curve for that is very short. Another important property that was alluded to today was that it's a self-expanding. And because of that, it helps to minimize the vessel wall injury, and it gives you an excellent apposition. And these two properties should reduce intimal proliferation. However, if you do get intimal proliferation, because of the fact that it actually grows, it means it compensates for and allows for greater intimal proliferation without encroaching on luminal size. I think to some extent, this actually compensates for the fact that this is not a drug-eluting and it's a bare metal. It can be used in a variety of the situation. Of course, it may not be that suitable for very low, shallow angle bifurcation, but otherwise it can be used in a variety of cases. It avoids the triangle of death, the gap that is between the, if you're using a T-stenting. It avoids crushing several layers of stents, as in crush techniques, and it's not affected by size mismatch between the main vessel and side branch. Of course, we talked about the fact that if you have a distal lesion in the diagonal vessel or the side branch, you still need another stent. And if you get longer stents in the future, that might obviate this problem. And also, I think the cases that we've done and the cases I've shown you really shows that you can get really extra and acute results with using this side guard branch. And I don't have no question about how good the results you can get in many difficult circumstances with this device. But the key point is we need long-term efficacy data. And that will be the cruncher. I think if you have good long-term efficacy data, this becomes the norm in terms of treating bifurcation lesions. And currently, we are undertaking a large registry study across Europe, and hopefully next year here, we should be able to show you those results. Thank you very much.